Psoriasis is a chronic inflammatory skin disease affecting about 1 in 100 people. It is characterized by erythematous, pruritic, and scaling skin lesions that often appear over joints. 1 in 12 patients with psoriasis will develop a condition called psoriatic arthritis. Psoriatic arthritis is an inflammatory disease characterized by psoriasis, plus symptoms such as joint pain and swelling, enthesitis, and uveitis. Psoriasis and psoriatic arthritis are both associated with increased risk of developing major depressive disorder or depression. Classically, this has been thought to be due to the cosmetic or physical disability incurred by psoriatic disease, but recent evidence also suggests that depression may be associated with increased systemic inflammation. Therefore, the purpose of our research was to identify whether psoriasis patients with depression are at increased risk of subsequently developing psoriatic arthritis. We utilized the Health Improvement Network, or THIN, a large medical records database from the United Kingdom to identify patients with psoriasis. Using THIN, we identified 73,447 patients with psoriasis. We ensured that each of these cases were new diagnoses of psoriasis, not records of diagnoses from years prior, and also ensured that these patients did not have a previous diagnosis of depression or psoriatic arthritis. At the time of psoriasis diagnosis, we identified a number of other variables that may potentially alter the disease course of psoriasis. These included age, sex, obesity status, smoking status, alcohol use, coexisting disease, socioeconomic status, and psoriasis severity, as determined by medication use or therapies. With psoriasis patients now identified, we then followed patients to identify those who developed depression and those who did not. Then, we stratified these results based on whether the patient had developed psoriatic arthritis or not. Using statistical modeling techniques, we determined if the risk of developing psoriatic arthritis was greater for psoriasis patients who developed depression compared to those who did not. Our results indicated that psoriasis patients who develop depression are 37% more likely to subsequently develop psoriatic arthritis, compared to patients who do not develop depression. This significantly increased risk was identified even after accounting for other variables that could influence the disease course. This result was also plotted over time. In this figure, the horizontal axis represents the total follow-up time in the study, up to 25 years. The vertical axis shows the proportion of psoriasis patients who develop psoriatic arthritis. It can be seen here that psoriasis patients with depression are more likely to develop psoriatic arthritis compared to psoriasis patients without depression. This research highlights that physicians should exercise heightened awareness for depression among psoriasis patients, as depression can significantly increase the likelihood that the patient will develop psoriatic arthritis. Second, the study highlights a number of questions regarding the pathophysiology of psoriatic disease and the role that depression may play in systemic inflammation. In conclusion, this study has demonstrated that individuals with psoriasis who develop depression are at significantly greater risk of developing psoriatic arthritis compared to psoriasis patients who do not develop depression.